Before we begin this episode talking about using the arts to address caregiver burnout, I want to talk specifically to any of you that are listening that are healthcare workers. We have a program at Heartseed Art called our Gratitude Grams program, and we want to invite any of you that are listening to enroll in this program. You can go to heartseedart.org/gratitudegrams. When you enroll, we pair you with one of our artists, musicians, and writers, and each week they will send you a personalized email and short 3 to 5 minute video with a message of thanks, an inspiring song, or an simple art activity or something to help just give you a moment of joy in your day, in your busy day. So if you're a healthcare worker listening, we'd love for you to engage with our Gratitude Grams program. Again, you can go to heartseedart.org/gratitudegrams. Now enjoy this episode. Welcome to Arts for the Health of It, a podcast where you will discover creative ways to improve your health and well-being. Someone may have told you that art isn't for you, but they were wrong. Anyone can create arts for the health of it. No talent or experience necessary.
I'm just a little songbird, try to fly my way homeward with the melody, and I make the beat. Don't know where it'll take me, cause when I'm in the dark of night, I sing my way back to the light. Come along with me and your heart will see that a song changes everything. Oh, oh, oh.
You may have been hearing a lot in the news right now about caregiver or healthcare worker burnout. And while it is at an all-time high after over a year of dealing with COVID, caregiver burnout isn't a new thing. It's been a problem that people have been trying to address for over a decade. And we have an amazing guest today who has made it his jam.
Literally
his jam to work on addressing this problem. So today we're talking to Dr. Alan Siegel, and he is a board member for the National Organization for Arts and Health and has helped to start their ARC program, which is Arts for Resiliency in Caregivers. I think that's right.
Arts for Resilience in Clinicians.
I was so close. Sorry, Alan. Good thing Richard kept good notes.
That's why I take notes.
That's why you take notes. But it was such a good episode. That was so fun, Richard.
This is what I loved. So Alan's like a doctor where he had an outline for this episode, and this is what I want to talk to you in point 1, point B, and
it was very organized,
right? So
he did our job for us. It was
yes,
wonderful.
and I was like, we should hire him for this podcast to figure out every episode, and we won't have to do anything. And then he shows up, and he's a musician, and he's in
a rock band.
People jump on the YouTube channel to watch this because there's a music video. This guy made a music video
at the end. It is true.
Oh, it's so good. Yeah, and just I love burnout has been such a buzzword over the last year, and I think it's really important, like you were saying, to talk about that it's not a new concept. It's just talked about finally, and how do we do that, and how do we combat it with the arts? And of course, Dr. Allen has it all figured out. So you just listen to the episode and then you do what he tells you to.
And Dr. Allen has some prescriptive arts for you at the end. So make sure you listen for that at the end. Also, to fact check myself, I almost sing a song at the end, but then I resisted because I was pretty sure that this particular song was not in the public domain, but it is. And
Dang it.
It entered the public domain in 2015, and I'm so glad I know that now.
So that's your trivia question for today. So before you get to that, tweet us. I don't know. What song do you think we're going to sing? We wanted to sing, but thought we couldn't, but could, but didn't.
This is getting complicated.
So you don't win a prize, but we might sing to you this song. Maybe. We'll call you up. You can come on the podcast, and we'll sing the song to you when it's your day.
Yes.
That's a hint. All right. That's enough of us talking. Here is Dr. Allen talking. Enjoy. Alan, how are you?
Good, thank you. Thanks for having me.
Thank you for being here. This is a topic we have been wanting to do an episode on. I know we're only a couple weeks into the podcast, but this was definitely in the top list of things we needed to talk about, which is healthcare worker burnout. And I mean, who better to have on here than the king of healthcare worker burnout help, you know?
Thank you.
Yes. We're super excited to have you on. You were always on our short list to talk. So I would love to hear, first, just tell our listeners a little bit about your background and what led you into this topic of caregiver burnout and trying to address it through the arts.
Thank you. Yeah. So I've been working for Contra Costa Health Services in Northern California for the last 21 years, almost 22 now. And part of that is with my background as a musician and interest in the arts. Have been running a program called Healing Through Creativity for the last 13, 14 years. We weren't able to do it last year, of course, because of COVID. But it's an amazing event that brings together probably about 80 healthcare workers at the hospital. And people perform for each other. They dance, they do music, they do visual arts. We have hands-on expressive arts. We've gotten into healthy eating and into other areas. And that was a really powerful experience, and a lot of people say is their favorite day at the county. So that was one piece. That probably led me to running a program in my own system for the last 10 years called Art of Health and Healing. So it's been an arts program that has done lots of different parts of it. That Healing Through Creativity was one part, but we've gotten involved with healing environments, gotten involved with starting a therapy prep program. We had a farmer's market for about 5 years with expressive arts and hands-on. And so that's how I've gotten into this work. And then in the last couple years, I joined the board for the National Organization for Arts and Health. And I've had my own experiences with some burnout over time, a long time ago, thankfully, once during residency and once early on in my academic career. Where I thought I was just experiencing depression. But in retrospect now, as I learn more about burnout, it's pretty clear that that was a big part of my experience. And so I don't want other people to suffer the way I suffered and the way lots of people suffer. And so it has felt like the right place for me to put my energies to be able to bring the arts, which, are a beautiful thing to offer and have really been used mostly with patients over the last 30 years, to our healthcare workers who are really struggling.
Could you maybe define burnout and what maybe leads to healthcare workers experiencing burnout?
Yeah, so burnout is by definition, it's work-related and has three components. One is exhaustion, one is mental distance from your job, and one is feeling decreased efficacy in your work. So any one of those components often gives you a diagnosis of burnout. And so, the fact is everybody has some level of burnout at this point, I think, after a year in COVID. But it has felt like a good place for us to put energy through NOAA, through the national organization. And we started a program about a year ago now to bring the arts to healthcare workers, because it's an area that has been done around the country, but only sporadically. And it really should be one of a key component for our employees and our staff.
So can you talk maybe a little bit about other examples of and reasons why maybe the arts help to address burnout?
I think it's a really interesting question, and I don't think we have all the answers. I think there's a lot of work being done around neurotransmitters and how it can help with some of, serotonin, which is something we use in depression, with dopamine, with several of the different neurotransmitters, and helping to activate them. And so I think that that's some of how it works. But I think in the real world that we understand, part of the beautiful part about the arts is it just hits you in lots of different ways. Often you're doing it in community, you're doing it with some of your colleagues. So that brings that whole level of just, we're all so alienated, especially during COVID, that doing things together is a helpful thing. Even if it's virtually, you're doing it together and there's that bonding experience. And especially with our event, people are seeing the other side and the human side of people. It hits different parts of the brain. I mean, when they've done all these MRIs, dynamic MRIs, they've shown that to actually light up the brain, they've done all kinds of things. And what lights up the brain the most is actually learning to play an instrument. Learning to do music actually lights up more parts of the brain than anything else that you study. So it's obviously brings in a lot of that. But what's cool in the arts is it's just multimodal. It just does it in so many different ways all at the same time, as opposed to, exercise works on your physical body. But, if you do something like Zumba, you have the music, you have the dance and the movement, you have the being in community. So there's a lot of different multiple aspects of it that I think make it a very powerful way to take care of yourself.
So you're saying singing really is my superpower because I'm lighting up my brain when I'm practicing?
Yes.
Yes.
And if you want to do it during this, that would be great.
Oh, no. Okay. You're in the hot seat today.
What I think is important, in the last year, we've talked a ton about burnout in hospitals, but like you were saying, that it's not a new concept. Why is it so high? And what you said, you haven't really had to deal with that in quite some time. So what have you been doing yourself to make sure you're staying in check?
Yeah, that's a good question. So it was really high. I think that burnout's been well studied probably in the last 10 years. And as far as the causes, a lot of that has been worked out. And, if you look at the peaks and valleys of the studies, at least I'm most familiar with the physician studies, which have been the worst burnout levels, usually around 45 to 55% of physicians are burned out.
Oof.
It seemed to peak at the time when the electronic medical record was getting the most rollout, which was an incredibly stressful year or two when you're doing that. For anybody who's been involved with it, it was just horrible. So I think that around 2014 is when the numbers were the worst, and about 54%. So I think the electronic medical record, which puts a lot of the work of caring for patients in the hands of that physician who does all the orders, reads all the messaging, it just really centralizes that kind of undue burden of all this bureaucratic work. And so that's been part of it. I think having electronic medical record and that is your main way that you interact with patients means that you don't look at the patient a lot. So a lot of your focus has to stay on the electronic medical record to enter the orders and to try to be efficient and all those things while you're seeing patients. So it's really, a lot of us went into medicine to work with patients, not to work with electronic medical record. And so it's hard to make that shift, and it's hard to make it work where the patient feels like you're there with them, and yet you have to get your certain amount of work done. And so working that balance is challenging. And then of course, in COVID, there's so many factors that have made it worse.
That goes without saying, right?
True for everybody, particularly for doctors and nurses and people working in healthcare. It's just some people have gone to different areas, or they don't want to. A big part of the concern has been bringing it home to your family. So some people have isolated themselves and not seen their family for months at a time because they were afraid that they would bring the disease home. There's the normal isolation that everybody has had. There is some people going, getting put into places that don't feel well trained. So say traveling nurses have gone to an ICU and they just need more people, and the ICU is bustling and they're not necessarily comfortable in that environment. So there's a lot of different reasons why COVID has been particularly hard on healthcare workers. There's people where your colleagues get sick and you're taking care of your colleagues, or over 3,600 people have died that are healthcare workers during COVID. And, so you're living with a certain level of fear. And, I can speak to my own, I am clinic-based, and you just kind of feel like you're a sitting duck. At some point, someone's going to walk in, they'll get through the screening at the door, and then, they either don't have symptoms, or COVID can have so many different symptoms that at some point it felt inevitable that we would get COVID.
Right. And have there been any studies done yet on maybe an increase in caregiver burnout because of COVID or in this last year? Is there data about that yet, or are people still working on that?
No, it's very clearly bad. How bad is it? That's a good question. There was just actually a study, very good timing, that came out, and those numbers are crazy. I mean, it's really that. And so usually it's pretty bad for physicians, but not as bad for nurses, often in the 20%, 25%. And not a lot of groups haven't been studied all that well. But here it was 55% of all healthcare workers had burnout. And then if you go to the worst group was the 18 to 39-year-olds, and that group had, 18 to 29-year-olds, and that group had 70%.
Oh my gosh.
Burnout. And then really high levels of anxiety and really high levels of depression. And, just, I don't know what we do with those numbers. I mean, we need to do something. And so it really, it feels like nobody knows what to do to fix this. A lot of it is really like start over with a new system is the way to fix it, which is probably not going to happen. But we feel like with the arts, we can actually address a lot of the individual factors, and that it's something we can do tomorrow. So, or today. Today's a good day.
Wow. Those numbers are so crazy. I'm still kind of like reeling from that a little bit. And there's this idea, you kind of alluded to it when you were talking about the burden of the electronic medical records. And many people go into medicine to care for people. And then I think I've heard about this idea about moral injury as one of the factors in burnout. Can you talk a little bit about that, and what is moral injury in context of healthcare and how it contributes to burnout?
Yeah, absolutely. I think when I read my first article and heard about moral injury, finally it hit home like, this is it. Because burnout never quite felt like something that many of us experience in the way that it's presented. But moral injury makes sense in that we know that we can provide really good care to patients if we're just given the right tools, enough time, get rid of some of the limits that we have on how we practice. So moral injury, which came from the literature around veterans and military, is the idea that, if you could just do it the way that you wanted to, that you could do a great job. But the fact that you every day, day in, day out, patient in, patient out, are sitting there and you can't provide the kind of care that you want, that you can, if you just, had the tools and didn't have such limitations, that leads to burnout. And that makes a lot of sense. And for people that I work in an underserved system, a county health system. And so I work with a lot of idealistic doctors and nurses and people that really want to help those who need help. And that's what feels right to us in that kind of environment, because that's the part that's frustrating. And so moral injury is a really interesting model, and I think is a real component for this. And a lot of the things that are being used in the military, actually some of the arts that are used in the military and with veterans, are things that we are looking at doing in healthcare.
If you go back in history, the arts have been around forever, and people have used them and people have done them, and there was never, like if you're good or bad, or you were just doing it. When do you think that kind of went away? Like, how come that never transitioned with us, evolved with us into the medical? Like, how come we just sort of went like, okay,
you do medicine, you do art,
yeah,
like compartmentalized, kind of.
Yes, and how come it's taken us this long to kind of come back around to be like, oh, right.
Well, and to add on to that, I think there's probably a lot of healthcare workers listening that might be hearing this and being like, well, I'm not an artist, so I couldn't do these things. So yeah, adding that on to Richard's question, how would you maybe speak to that objection?
Yeah, I think that the world of medicine became very sterile. And I don't know if that was the 50s or, around the time when we were understanding more about bacteria and viruses and antibiotics were invented and those kind of things. They decided to make it a very sterile environment. And I don't know exactly how that decision was made, but I think that the arts and health in communities has been millennia, has been the norm. And then somehow we got into this very sterile thing. And then that doesn't work. We're not, we're not built that way. The arts bring so much richness to us and who we are in community and how we interact. So it's been a little bit crazy that we do these arts things on the side, but yet in healthcare, for the most part, we don't do any of it. And there was, boring things on the walls or nothing on the walls. And it was, people wearing all white and just not things that are artistic. And so I think there's been more of an appreciation over the last 30 years. And that's when, they've started to enter there. And what I'm amazed, as I've learned more and gotten into this, is just how so few people know that this even exists, that it's such a rich area that brings so much for the patients. And I think for healthcare workers and, many people, I have to keep explaining what it is that I'm doing over and over again because nobody understands. And it's just
preaching to the choir. Yes.
And in my mind, why would we not want to use all the tools that we have available to us? And, that's true for patients. And we've been better at it for patients, but still it's not a universal thing at all. And then we have been using it very little for healthcare workers. And I think that that's an area that I feel like, that we can really change and we need to change.
It even takes, I think, a while for healthcare workers who know how great it is for their patients when they're invited into an art class or sung to, they think, oh, me? I thought that was for the patients. They don't even correlate that it could also be good for them, which I think is really interesting, that they're so disconnected from, this is my job and I'm here, whatever the patient needs is why I'm here. And then but no one's taking care of you. That's why we're here. That's why.
Yeah. And that's absolutely the paradigm in medicine is, and that's what you learn in school is it's all about the patient, and anything you do for the patient is the right thing. So it's really not a model where we learn to take care of ourselves.
There was a really great testimonial that we received from Lindsay Richards, who works at Memorial Sloan Kettering Cancer Center, when she enrolled in our Gratitude Grams program. She said, "Thank you so much for including me in such a wonderful program. This truly made my day. I feel that oftentimes the work we do takes precedence over the fact that we are also people trying to survive this pandemic. You taking the time to send this and create such an amazing program is most appreciated." Yada, yada, yada. But I think that really sums up, and that's what we're hearing from the healthcare workers is oh yeah, I kind of forget. I'm trying to survive too.
Right.
And I'm a human too, and I'm deserving of love and care and attention. And without that, we shrivel up and die. And then we don't, then there's nothing to give to care for others, right?
It's always that precious moment when it clicks and you're, I've been in art classes with a nurse who's I have 10 minutes. Can I sit down? Of course you can sit down. And suddenly they're crying because they realize what it was, and, setting up special rooms for them. And we do things in break rooms for local nursing staff, and just the excitement, even just singing to them. They're just sitting there watching and they're crying because they're oh my gosh, you stood by me for 10 seconds. Yes.
Well, I think
it's so important.
Well, I think we're circling around some of the challenges there that we face in trying to bring these types of activities to healthcare workers and into a healthcare environment. Can you speak to some of that? Just some of the challenges of incorporating the arts for healthcare workers?
Yeah, absolutely. So over the last year, it's been even more challenging because
right,
incredible budget cuts. I can speak from my own budget cuts, but it's a thing all across the country. So at a time that these programs are needed the most, there hasn't been funding to do that, and then artists have also been removed from the healthcare setting. I'd say at least half around the country, and that's kind of borne out in some of the research that we've done. And so So I loved having our artists around, and people, would get giddy with that of just having artists, even if they're, as you said, even if they're working with the patients and they might just get a little bit of it, that's nice. But it's been hard to not have them in the healthcare setting. And, where many of us are fighting to get them back into the healthcare setting as things are getting better in our hospital and in the area. So that's part of it. But then there's the real issue that healthcare workers are busy, and that trying to fit in something more into their day is very challenging. So when we're looking at programming, as you mentioned, it might be a minute, it might be 5 minutes, it might be 10 minutes, but that's about the limit of what we can do, because people are just so busy, and we don't want to ask them to do more when they go home. And the real answer is that healthcare systems need to support it, and they need to give time for their staff to do it. And that's the only real answer that's going to work to be able to get people to do this stuff, because we can't just ask people to do more. They're just doing so much. So I think you have to have systems really buy in that this is worth investing time, which of course is money, into, and that you have to do it. I mean, it's just, that the wellness of our staff is really one of the highest priorities, along with patient care and along with all these regulations and guidelines and things that we have to do. We have to take care of our people. It's part of the quadruple aim. The fourth aim is to take care of your staff and have a well-functioning, happy staff.
So you have kind of helped start and are now leading the ARC program at the National Organization for Arts and Health. Can you talk a little bit about that, what it is? What are some of the initiatives going on with that? Take it away.
I'd be happy to. So we had been forming a working group. We had a leadership summit last January of 2020, losing track of years. And one of the 3 topics was clinician burnout. And we had an amazing group there, and we formed a strategic plan, and we were planning to move forward. And we started to meet in February, and then March, we all know what happened.
Dun, dun, dun.
So clearly we needed to focus on, healthcare workers in the time of COVID. And so we started this project, ARC, which stands for Arts for Resilience in Clinicians. And, at a time that it's very hard to have artists in healthcare systems, we wanted to do most of it virtually. And we want to do a combination of things that are accessible to people. So generally, our main ideas are to create some videos where people can engage with the arts. And so they can watch it. It might be a 5, 10, 15-minute video that they can, I prefer active than passive, but we'll probably have some passive stuff, because some people just don't want to do active. But they will, where they can watch something, take some instruction, maybe do, write a poem, or, do something with the video leading them. A second component is to have classes led by an artist or art therapist. A third component would be to have more small group one-on-one or one-on-3 kind of small groups that people can sign up for times, and maybe 15, 20 minutes with an artist or art therapist. Maybe they want to figure out what their art form is. Maybe they want to work on something specifically, but be able to do that. And then we've added on a component of being able, some people don't want to do anything virtually and don't want to do anything digitally. So we've added on, maybe a workbook so that people could work on things. And so my co-director is Cindy Perlis, who had started a program at UCSF, I think 30 years ago as well. And she's written some books. And so we're looking at starting with one of those prompt books, but developing our own workbooks from all the artists and art therapists that will work with us. So we've been working on this for a while. We've been having this amazing working group. We meet frequently and have a lot of great ideas. And then the funding has actually been really challenging to be able to roll this out. So a couple months ago, we decided to change gears and are going to be rolling out a website that will be, because the main point of this was to get healthcare workers engaging with the arts, and we're still not there yet. And so as of a month from now or something, when we roll this out, all healthcare workers around the country can access this portal and be able to access the videos and eventually classes that will run through that. And so right now we're getting some donated videos and going to be able to post those to make them available. You know, if it's 12 o'clock at night, if it's whenever, 24 hours a day, people can access this stuff. And we're also wanting to roll out, and probably will roll out, a pilot for a program, some in person, some virtually, probably in New York in the next few months. And we're working on a grant where we can do research as well. So, you know, we've got some things in the fire right now. And
and that's being released on the 21st of May, correct?
We don't have a release date yet.
Okay.
We will probably have some materials available. And, you know, we're also going to use this website as a hub to have articles around burnout, to have articles and literature around arts and health. As one place that people can go to really capture all this stuff, because there isn't anything like that. So it'll be part of the NOAA website, which is the NOAA.net. And so you can always access it from there. But people will have all that stuff. So we will have part of it available within a couple weeks, but we're waiting for videos. And so that will probably happen about a middle of May, maybe, I would guess.
Okay. Awesome.
I want to switch gears for a little bit, because you've been very busy, but also you've had time to make your own music video. And I want to talk to you about being a rock star and what that writing experience was like. And then, you know, if you're listening to this on whatever platform you listen to podcasts, you should jump over to our YouTube channel, because we're about to play the music video in a second too. But I want to talk to you about how that came about and how that was for you.
Well, it's been really, I didn't know we were going to play it. That's great. So
you sent it, I'll play it.
I wrote the song. You write things when you need to write them. I was about to run a workshop, our first one, about a year and a half ago in Boston at our national, at our NOAA conference. And we did a pre-conference on this topic, on clinician burnout and using the arts. And actually I had partnered with the author of the article from Moral Injury. So that's why when you bring it up, I'm like, oh, it's such an important area to me. And I love their work. But anyway, Simon Talbot is up at Harvard. And so anyway, we partnered together and did that. And so I was actually away at a camp with my family, family performing arts camp, and they had a songwriting class. And I was like, this is a month from now. I want to write this song. I kind of knew what I wanted to do, and just like wham, and did that and recorded it like a year ago Thanksgiving, and then more recently put it together with a video to be able to show and let people experience a little bit around physician burnout.
Oh my gosh.
I love that it's like the exact intersection of arts and health. Like it's so, I love it. When I saw it in your notes, I was like, oh my gosh, yes, this is so like you can have fun and also talk about some serious stuff. Can we play the video?
Absolutely.
All right, Ivan, it's in there. Can we watch it, please?
Going along, no longer hearing this song. A person in front of me just keeps talking too long. Gotta move on in my hamster wheel. Get through this day with nothing to feel. Finding the light, bring it into my sights. Remembering the day when it feels like night. Feel the dark places of my soul. Getting back what others stole. How long can this go on? How long can this last? I've gotten into a hole, don't know how to get past. This is not who I am, this is not why I'm here. I'm just stuck here on this screen, holding back my tears. Finding the light, bring it into my sides. Remembering the day when it feels like a night. Feel the dark places of my soul. Getting back what others stole. Can I sing my way out? Write a story with a better ending? Can I draw my way out? Move my body and awake my senses? Can I breathe my way out? Find my breath so I can live again? Believe again. Light, bring it into my sights. Remembering the day when it feels like night. Feel the dark places of my soul. Getting back what others stole.
Oh, thank you.
If I had a lighter, I would be. When does your album
Nice
drop?
surprise.
What a great way to did that feel really good to kind of go through that creative process to put all that into words and music?
Yeah, it's been really fun for that song. And I've written other songs before. I haven't created a video, but it's, I think it's it's been interesting that when I play it, people are like, "Are you okay?" And I'm like, "Yeah."
Because I wrote that song.
I am now, yes.
Yeah, I mean, I think I was bringing in past experiences and knowledge and all those things together. And so the fact that it evokes emotion is great. That's what I think music is supposed to do. And so it has felt, definitely healing to bring that.
So let's say we have people listening and they're like, okay, well, I don't play guitar and maybe I don't my write music.
Skills aren't great. Make a music video.
Right. But what are some things that people could do today to incorporate some creativity into like a self-care practice? What would you recommend?
Yes, I think it's a great question. And it really is the vision of that, I believe, and, a lot of us believe that the arts is as important as people's exercise routine and how people eat and meditation or mindfulness or yoga and, probably going out into nature. So I think that putting it in that realm, for whatever reason, we haven't thought that way about it in this country. UK, they've been doing it for years and they have social prescribing and they really take it very seriously. And their studies are incredible. And it's basically, I know I'm getting off the topic, but I just think it's such a great thing for us to access as part of the healing. But it really is. They found that engaging with the arts once a month is as good as exercising a couple times a week for a lot of features, whether it's death or high blood pressure or heart attacks or lots of things. So
this is why I don't go to the gym. This is why I tell people all the time.
There you go.
Well,
I don't go to the gym. I go to the theater.
Exactly.
Yes.
So I think thinking of ways to do it that are very accessible is the important part as we're thinking about healthcare worker and whoever is listening to this. So some easy ideas, I come from the music, so maybe making a playlist. So thinking about songs that bring out some type of emotion, joy, calm, meditative, and make a playlist of that songs to use during different times when you either want to feel that way or you are feeling that way to help you with that. So I think music is a really powerful thing, and that's just such a simple thing to do. I think you could also take your favorite song and maybe rewrite lyrics, and you could write an extra verse. You could rewrite the lyrics. And that can be a really accessible thing to do. From the visual arts, you could create a drawing or write a story. Think about who you were before COVID. Think about who you are now, and write about it, draw about it, do something about it. So those are very accessible things. Another one, you could put your hand down on a piece of paper and draw an outline of your fingers. And in the middle one, do some words of strength. Well, some words of strength on the different fingers. In the middle, write your core beliefs about yourself. And then just think about that experience and reflect it. And then movement, of course, that is a very accessible one. I've done a lot of groups with kids, and one of the fun ones with pediatric obesity is what my groups were, or some of my groups were, and they did mirror dance. And so someone moves, and then the person you're doing it with also moves. And it's just again, this is multimodal. It's a way for you to bond and join with somebody else. It's a way for you to move. If you're playing music, you're hearing music at the same time. So just think about things. And I one of my colleagues has gotten into Zumba, and he's like, does that count as engaging with the arts? I'm like, yeah, on multiple levels. Because it's all those things at the same time. And so I think these are really accessible, powerful things to do instead of running or doing something that, use something that brings in some different art forms, because it's just, you get a lot of different ways that you benefit from that.
Well, you heard it here, folks. Dr. Allen has prescribed some arts activities for you to try.
Absolutely.
What is the last creative thing you did?
I am playing with a band called Enjoyous, and so getting to play. We're back practicing outside and hoping to, as bars and clubs are starting to open with outside venues, and we're all getting immunized, or at least the rest of the band's getting immunized, hoping to play. I love playing music with other people, so that is my main thing to do. Although I have 2 small children, and I've done more visual art since they've been born than the rest of my life put together. And so, last night I was drawing, Homer Simpson,
Nice.
with my daughter, and so I'm getting to do some different stuff.
I love that. How can people best connect with you?
Well, I'm happy to share either through Noah. I am happy to give my email address. It's Dr. Allen, DoctorAlan @gmail.com, or through LinkedIn or Facebook or any of those things. Yeah.
And
Awesome.
also, we can't end this because it's your birthday tomorrow. So happy birthday.
Thank you.
Thank you for celebrating with us. Do you have birthday plans?
I am planning. So last year I did my first ever Zoom birthday. That was the weirdest thing I think I've ever done. And I was totally hesitant. And a friend of mine made me. and it was really beautiful. It was actually like people telling you how wonderful you are, and those kind of things from different parts of the country and different parts of your life. And so that was beautiful. So this, I will probably do a little more traditional of having a small group of people outside and hopefully playing some music, eating some food, and celebrate.
I love it.
I would sing you happy birthday, but it is not yet in the public domain. So I will just sing it in my head. Happy
birthday is not?
Dr. Allen. No, it's not.
All right, I have questions. Really?
Another time.
Last I looked.
Wow. I feel like that was like one of those Christmas songs where everybody can sing it.
No,
and no one gets in trouble. All right.
I don't think it's enforced very often, but we'll just err on the safe side.
Right. Well, we're also here to tell you how amazing we think you are, and we appreciate you jumping on tonight and talking to us, and spending your birthday eve with us.
Yeah.
Well, I really appreciate you guys bringing me on, and I think it's a really important message. So I
think when the band gets back together, you should come on and do a performance.
Awesome. Will do. Thank you very much.
That is our episode for today, everyone. Thank you for listening. Thank you for watching. Make sure you subscribe to wherever you're watching or listening. Keep creating, everyone. Have a great night, week, and we will see you next week with an all-new episode.
Take
Thank
care.
you.
Thank you for listening to Arts for the Health of It, a podcast produced by Hearts Need Art Creative Support for Patients and Caregivers in partnership with the National Organization for Arts and Health. You can help others learn about the healing power of the arts by subscribing, sharing, and reviewing the podcast wherever you listen or watch. The podcast is hosted by Richard Wilmore, co-hosted by Constanza Rader, and produced by Ivan Briones. Our theme song, Songbird, is written and performed by Natalie Lane. Visit heartsneedart.org to learn how you can support our mission to create joy with people facing life-altering health challenges. Join us next week to learn more ways you can create arts for the health of it. The views expressed on this podcast do not necessarily reflect the views of Hearts Need Art, their staff, board members, or other affiliates. All content is created for informational purposes only. This podcast is not intended to be a substitute for professional medical advice or to diagnose and treat any health condition. Always seek the advice of your physician or other qualified health professional with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.